Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Annisa Ridlayanti. I'm from IHEX Bandung University. I want to present about implementation of Islamic midwifery holistic care as an excellent curriculum in undergraduate midwifery education and midwife profession at IHEX Bandung University. This is my theme. The content of this paper include introductions, methodology, analysis, discussions, conclusions, and reference. Maternal mortality rate in Indonesia is 305 per 1,000 live births. Infant mortality rate is 32 per 1,000 live births. Maternal mortality rate is an indicator of women's health levels that describes the level of access, integrity, and effectiveness of the health sector. Midwife, as a health workers, have a duty to able to accompany and provide women's health services in their reproductive cycle. Midwife duties are educating and empowering women as a promotive and preventive effort so that mothers have the awareness to play an active role in maintaining their health. What is curriculum? Curriculum is a set of a planning system that arrangement regarding learning materials that can be guided in teaching and learning activities. Al-Islam Kemuhammadiyahan is the entire teaching of Islam, which includes akidah, akhlak, worship, and worldly muamalat, which is based on the Quran and the Sunnah of Prophet Muhammad Sallallahu Alaihi Wasallam. The Islamic Midwifery Holistic Care course aims to encourage students to show professional attitude, integrity, and Karimah morals when providing midwifery care according to the scope of midwifery practice. The competencies expected from this learning include the competence of cognitive, affective, and psychomotor aspects of midwifery undergraduate student and midwife professional educations. Here are curriculum book and model learning of Islamic midwifery holistic care subjects. Both of them have legacy from intellectual legacy, Ministry of Law, and Human Rights. This is the mapping competencies. We use the model cycle curriculum that contains cognition, attitude, and skills. The first cycle, second cycle, third cycles. It means that the student must pass from the first level until the second cycle and then the third cycle. So finally, the undergraduate midwifery students, if graduate from the study, it can show 5-star profile, include care provider, communicator, community leader, decision maker, and manager. This is the Islamic midwifery holistic care concept that implemented in this study program. We know that Islamic midwifery holistic care must show or describe from biological and or physiological aspect, emotional or psychological aspect, cultural or social aspect, and spiritual aspect. All of this aspect can show Islamic midwifery holistic care that must implement in antenatal care, intranatal care, postnatal care, neonatal care, emergency maternal and neonatal care, community midwifery care, health reproductive health, and management professional midwifery care practice. From the methodology research design, we use survey analytic divided into two design, quantitative and qualitative research. Quantitative research use pre-post experimental research design and student assessment, contains cognitive skill, case-based multiple choice, student oral case analysis, affective skill, skill laboratory, psychomotor skill, practical skill, integrated holistic therapy, bedside teaching, DOPS mini CX, spiritual skill, prior guidance skills, and for the qualitative skill, use focus group discussion, structured task, deep interview, tutorial 7 jam, and based on student-centered learning. Before team teaching give the lesson to the student, the competencies of these three aspects are mapped in the course learning design of Islamic midwifery holistic care. This is for the sample. This is for the documentation from all of the activities in this course, from midwifery, from the laboratorium, and from the description from the student, SOCA, and then discovery learning, multiple choice question based on the case, clinical assessment, or clinical studies use the bedside teaching method, and then finally training from the holistic care, for example, prenatal, postnatal, and neonatal care service. This is for the skill Mariam exercise that can implement it to the labor woman, and the baby spa that can implement baby. Sampling technique in this study use total sampling. Subject of the research, there are 520 midwifery students and location in IHEX Bandung University. The procedure, stage of curriculum preparation, implementation curriculum, and next assessment and evaluations. Statistical analysis use frequencies, distributions, and priority tests. How's the result? The result of this excellent curriculum shows that of the 146 credits given in the midwifery undergraduate study program, there are 20 credit 12 courses and 7 credit 8 courses of ICA curriculum integration in midwifery core courses at the undergraduate and professional level. The percentage of excellent courses is 25.5% at the level undergraduate and 80% at the professional level. The distribution of credit for the excellence of Islamic midwifery holistic care integration is 36% at the undergraduate and professional levels. This is the table that shows integration of Islamic midwifery holistic care at the undergraduate and professional levels. In the undergraduate levels shows 25.5% and professional level shows 80%. Integrations in the credits, we can see that there are 27 credits. It means 36% that integration of Islamic midwifery holistic care credits in the curriculum. The diagram shows that the study learning result from the student from 2020 until 2023. From diagram, we can see there is increasing result from the student. The implementation of Islamic midwifery holistic care is midwifery core courses in the 4th year covers 100%. The final year student study in 2023 shows an increase in understanding of Islamic midwifery holistic care in cognitive, affective, and psychomotor aspect by 81.5%. Quantitative analysis shows that there are significant differences before and after learning Islamic midwifery holistic care in students in these three aspects with p-value 0.0 less than 0.05, and the qualitative analysis shows that students always practice prayer guidance both to themselves and to client before, during, and after the care process. And the conclusions of this study is that the implementation of Islamic holistic care as a curriculum of excellence in midwifery undergraduate education and the midwife profession at IHEX Bandung University is excellent. In order to maximize learning outcomes in the following year, there needs to be consistency and continuity in the implementation of Islamic midwifery holistic excellence courses in the following years, so that the performance of Muslim midwives can be reflected in graduate midwife. This is the student's testimony about course of Islamic midwifery holistic care.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Robi sahri sodri wa yassirli amri wahlul uqdatan min lisani yafqahu qawli. Perkenalkan, nama saya Annisa Ridlayanti. Saya mahasiswi Sarjana Kebidanan dan Profesi Kebidanan Universitas IHEX Bandung. Alhamdulillah, dengan saya kuliah di Universitas IHEX Bandung, saya mendapatkan ilmu yang sangat-sangat bermanfaat sekali untuk profesi dan untuk masyarakat sekitar, terutama asuhan kebidanan holistik Islami yang sangat membuat klien menjadi lebih rileks dan lebih nyaman. Beberapa asuhan kebidanan holistik Islami yang diberikan, diantaranya yaitu akupresur, prenatal massage, postnatal massage, baby spa. Baby spa ini terdiri dari baby gym, baby massage, dan baby swimming. Kemudian persalinan Maryam, dan juga meditasi Islami. Terima kasih Unisa atas segala ilmu-ilmunya. Semoga bermanfaat dunia akhirat. Amin. Wassalamualaikum warahmatullahi wabarakatuh.
This is for the references. Finally, thanks for the attention. I'm Annisa Ridlayanti. Wassalamualaikum warahmatullahi wabarakatuh.